Does your child need residential treatment? One of the most challenging decisions for any parent to face is whether their child should be placed into treatment. If you are at the point of wrestling with this decision, chances are your family has faced incredible hardship. Your child may have been hospitalized. They may be violent or aggressive. You might have called the police. The road you are walking feels incredibly lonely and heartbreaking. You may feel that no one understands your struggles. Please know you are not alone. Mental health issues, addiction, family issues, and trauma are problems that many children face. The need for residential treatment for children is often overlooked or brushed off due to an incorrect belief that children cannot have mental health struggles. Without help, these challenges can lead to serious consequences, including suicide, early pregnancy, drug use, alcoholism, self-harm, or depression. Treatment programs provide families with support, guidance, and holistic programming. When a child is placed into treatment, they are in a safe location where they are supervised 24 hours a day, 7 days a week, and your family can begin to recover and heal. Residential treatment for children is when a child is temporarily removed from their home to live in a residential facility for the purposes of therapy, medical care, autism programs, or mental health services. When kids live away from their family, the program provides stability and consistency for the child while they work on overcoming an addiction or a mental health issue. Parents are typically allowed to visit at set times and are encouraged to stay involved in the child's therapy and treatment plan. So what is the difference between inpatient therapy and residential treatment? This is a question that we receive often. Inpatient therapy is for short-term stabilization treatment, and residential treatment is long-term with a focus on long-lasting changes in behavior. Inpatient treatment is typically for less than 30 days. Inpatient therapy is usually carried out in a hospital or a children's behavior health center. This type of therapy may be recommended for children who have been struggling with depression and suicidal thoughts, self-harm, psychosis, personality disorders, violence and aggression, or eating disorders. Inpatient therapy is meant for situations where your child is in danger of hurting themselves or others. The remainder of this video focuses on residential treatment, but you can learn more about inpatient therapy on our website, www.childresidentialtreatment.com. So, how long will your child stay in residential treatment? Kids typically stay in residential programs for 6 to 9 months. Very few programs allow a child to stay longer than 1 year, although there are a few exceptions. The length of the program stay is based on how serious the mental health and behavior needs of the child are. The goal is to determine what the student needs in order to live a healthier life, including being safe with themselves and others. What do residential treatment programs include? Programs vary, but most residential treatment provides a secure, often locked, location where staff supervise the children 24 hours a day, 7 days a week, 365 days per year. Residential treatment programs are available for many mental health and behavior issues. While in residential care, children live at the facility and attend school, go to therapy, and engage in positive activities. What is residential treatment like? Children who live in residential treatment stay in a bedroom by themselves or sometimes with another child. They are allowed to have some of their own belongings, such as clothes, books, and toys. If children do not have these items, the facility will provide them. At residential treatment, often there is a behavior program where children receive rewards or privileges when they engage in appropriate behavior. Children who exhibit safe behavior may be taken into the community for age-appropriate field trips, shopping, and activities. All activities are carefully supervised by staff. What are symptoms that require residential treatment? The first thing to look for when considering residential treatment is to see if your child exhibits any of the common symptoms that require this type of care. A child will need a diagnosis by a medical professional in order to qualify for treatment. These include mania, depression, schizophrenia, bipolar disorder, anxiety disorders, eating disorders, post-traumatic stress disorder, obsessive-compulsive disorder, oppositional defiant disorder or conduct disorder, borderline personality disorder, reactive attachment disorder, and problematic sexualized behaviors. When should parents consider residential treatment? The main objective of residential treatment is to provide intensive intervention in a safe, nurturing environment. There are many factors that may lead to the decision to consider this type of care. These can include trauma history, mental health history, current emotional needs, and the child's current emotional state. Residential treatment is a high-level intervention and therefore only for children with the greatest level of special needs. Often, only children who are dangerous to themselves or others will qualify for out-of-home treatment. If your child's situation is not severe enough to warrant residential treatment, there are other options. Therapeutic boarding schools, wilderness programs, and military schools often accept children with less severe behavior or mental health needs. We have information about all of these types of programs on our website. What are the risks of residential treatment for kids? While residential treatment programs are often the last resort for youth who need intense rehabilitation, there are some risks to consider. Children are meant to live in families and communities. Taking a child out of their home and placing them in residential care is putting them into an artificial situation. Relationships with parents, siblings, relatives, and friends may be damaged or estranged during this time away. Another issue that arises with children in centers is that they are at risk of learning negative behaviors from other students. Finally, it's possible that the child will return home without improvement or even being worse. How can families afford residential treatment? The high cost of residential treatment can make it difficult for families to afford, but there are some steps you can take to make this achievable. It's worth noting that most insurance companies, including Medicaid, cover a portion of residential treatment costs. If you are planning to self-pay for care, there are programs for different needs and budgets, so do your research. Once you have found some suitable programs, calculate how much it will cost per day and compare those prices with what you can afford. Cost does not necessarily equal the quality of the program. In limited situations, school districts or the foster care system will pay for out-of-home placements. Here's how to find the right program for your child. Check out the many types of programs available. Options include residential treatment centers, therapeutic boarding schools, therapeutic day schools, and group homes. Parents can find a school that fits their needs by looking at what they hope to achieve from the therapeutic program that they choose for their child. A residential treatment center can provide education, therapy, and structure for children with behavior problems. While the decision to place a child into treatment is never an easy one, sometimes it is the most loving choice a parent can make. We are here at childresidentialtreatment.com to provide you with support and information as you make this important decision.